Welcome to Kacey Diagnostics presents Culture and Sensitivity System Training, Part 2, Sensitivity Testing. Procedures and techniques for performing in-house antibiotic sensitivities on cultured Kacey MultiChrome biplates. Choosing the right drug for the right bug. Why use Kacey SensiRing? In-house rapid identification in 24 hours of bacterial antibiotic sensitivity using 8 of the most common veterinary antibiotic choices per ring. Cost effective, less than a third the cost of a commercial laboratory like Antec and IDEXX. Specific SensiRing for both gram-positive and gram-negative. System-specific SensiRing for urinary tract infection, ear infection, skin and wound infection. SensiRing supplies for each test. 1 Kacey 100 mm Mueller-Hinton agar plate. Please note that these are larger than the normal Mueller-Hinton plates on the market. They are designed specifically for use with the SensiRing discs. 1 each WST dilution solution. 1 each sterile rayon swab and 1 each sterile loop. And finally, 1 each SensiRing disc in its sterile pouch. For added convenience, we also offer a culture and sensitivity starter kit, enough for 4 complete tests with all the supplies you need. Product 20241. Step 1. Obtaining live cultured bacteria from a Kacey MultiChrome biplate. Using the yellow 10 microliter loop, take 3 to 4 passes through the bacterial growth on the MultiChrome. Please note that in the future the yellow loop may be blue, but it will continue to be 10 microliters. Step 2. Mixing with saline, WST, to dilute. Insert the yellow loop into the saline and twirl to make a cloudy solution. This is an important step to avoid overgrowth of the bacterial colony. Step 2A. Turbidity Reference Test. Compare sample to the Kacey Turbidity Standard Tube, known as KTS, with the white cap. Samples should match in turbidity to ensure correct dilution. If not, add more WST solution from the green top tube, or add more from the bacterial sample to match the KTS tube. A second way to do this is to place the tubes in front of the Kacey turbidity card enclosed with each WST solution kit. The horizontal lines should look the same through both tubes. Step 3. Removing the diluted sample with enclosed rayon swab. Take a sample using the applicator tip of the swab. Again, do not use cotton swabs. Even if sterile, cotton will release a chemical that will alter the results. Step 4. Inoculate diluted bacteria onto Kacey Maxey Mueller-Hinton plate. Using the diluted bacteria solution on the soaked swab, evenly distribute the sample onto a warmed Kacey Maxey Mueller-Hinton plate at 37 degrees for 15 to 20 minutes. Streak the plate as shown below: 11 to 5, 1 to 7, and 9 to 3 o'clock, and also a 360-degree circle for full saturation. Please note that Kacey Maxey Mueller-Hinton plates are true 100 millimeter plates. Most commercially sold Mueller-Hinton plates are 88 millimeters and will not work with this system. Step 5. Applying the SensiRing. Pick up the appropriate SensiRing, i.e. gram-positive, gram-negative, ear, UTI, or skin wound, depending on sample's origin. Grasp the tab on the inside of the ring and lower onto the agar, centering the ring with tweezers. Step 7. Incubate upside down. Place a Kacey Maximüller Hinton plate, now inoculated, upside down to prevent any contamination from condensation. Place into a preheated Kacey incubator at 37 degrees for 24 hours. Step 8. Remove and read after 24 hours. Carefully remove incubated plate using gloves. Remember, this is a live bacterial colony. Step 9. Use a Kacey Zone Reader card. 1. Place a template over the bottom of the Mueller-Hinton plate. 2. Align the key notch on the template with the key notch on the Sensi ring. Place the word key in the template notch reader. 3. Interpret and record the zone size for each antibiotic on the Kacey patient report form. 4. Select the antibiotic of choice for the 3 zone values: resistant, intermediate, and susceptible. Step 10. Log test results. Using the patient lab report form supplied, log inhibition zones for each antibiotic disc. Step 11. Treat with appropriate antibiotic. Based on results, a course of action can now be taken with the most efficacious antibiotics based on the inhibition zones noted. The various Sensi ring discs contain the most varied assortment of antibiotics covering a wide spectrum to ensure good sensitivity results. Alternate bacteriology protocol inoculating Mueller-Hinton plate first. With Kacey culture and sensitivity system, it is possible to first directly inoculate a Maxi-Mueller-Hinton plate, incubate for 24 hours, and determine the most efficacious antibiotic before actually identifying the bacteria. A sample can be drawn from the center area of the Sensi ring on the Mueller-Hinton plate and transferred to a MultiChrome plate for incubation and identification of the bacteria. Alternate bacteriology protocol inoculating Mueller-Hinton plate first. Continued. Urine samples. Spin down urine and do cytology on the sample of the sediment. If bacteria is present, directly inoculate sediment onto a Kacey Maximüller-Hinton plate with a sterile rayon swab enclosed. Smear evenly over the surface as described in step 4. For ear samples, do a cytology on each ear swab. If bacteria is present, directly inoculate the Kacey Maximüller-Hinton plate with the sample smeared evenly over the surface as described in step 4. Sensi ring case samples. Case study. 2-year-old canine which cultured on the MultiChrome both a large colony of gram-positive staph in pink and a smaller strep colony in blue. The colonies, when tested for sensitivity using the Sensi ring, indicated sensitivity to a variety of antibiotics not previously used. UTI and ear samples. Here are samples of urinary tract infection and ear infections as they are seen on the Sensi ring sensitivity discs. Sensi ring ability to identify different strains of bacteria. Sensi rings used to identify antibiotic sensitivity on different strains of cultured staphylococci. Sensi ring quick reference cards. These handy cards break down the process into 3 steps. These can be found in the Quick Starter Kit and are also available directly from Kacey. Sensi ring quick reference cards continued. On the back of the quick reference card, we have enclosed a convenient microbial zone inhibition interpretive chart. This includes the various antibiotics on the Sensi rings, along with their Sensi codes and disc potency, as well as the various metrics for determining their efficacy. Step 12. Disposal of plate and cleanup. Once read, plate should be sprayed with a bactericidal agent, covered with its lid taped shut, placed in a plastic bag, and disposed of in your biohazard bin. If you have a Kacey sanitizer coming soon, follow its instructions. Place lid back on the plate, tape it shut, bag it, and dispose of it in your biohazard bin. Dispose of all used supplies in your biohazard bin. Spray your counters down and wash your hands in an aseptic manner. Remember, these are live cultures. And this concludes the second part of the Culture and Sensitivity Training Program. We are confident that with the tools provided, you will become proficient at sensitivity testing with the SensiRing system. Thank you for listening.